So we also have chief cell, G cells and G cells secret gastrin, and the chief cells secret pepsin. And the gastric secretion also is regulated by the neuronal control. It's hormonal as well as neuronal control. Neuronal control from the secretion. You must have read again in the physiology. There are 3 to 4 stages of gastric secretion. Cephalic. We were fascinated. Cephalic, when we were talking in physiology or first year MBBS, a cephalic part of the gastric secretion. Whenever we see the food, we right from the oral cavity, the saliva, we it is secreted just by looking at the food or just smelling the food or listening about the food. When I talk about some food, sometimes we may water in our mouth. The same thing can also happen in the stomach. These are called cephalic phase, gastric phase, intestinal phase. When the chyme stimulates the intestinal gastric secretion, that is called as the intestinal phase. So we have cephalic phase, gastric phase, and intestinal phase of gastric secretion regulation. So emptying, as I said, it starts from 1 hour. It ends by 2.5 or 3 hours. Maximum it takes 4 hours to empty the contents. Then the pyloric sphincter relaxes and the food is pushed down. The hydrochloric acid, also another very important function of hydrochloric acid is it also sterilizes the stomach. It detoxifies certain chemicals and also tries to kill the bacteria that is going along with the food if it is contaminated. And the HCl, the hydrochloric acid, also converts pepsinogen into pepsin, and the gastrin, the G cells secrete gastrin, which stimulates the acid secretion. So everything is interdependent. So we also have D cells, as I told you. D cells secrete somatostatin. It suppresses the acid secretion. So the G cell and D cell action is antagonist to each other. So we have another very important hormone called ghrelin, which is secreted by oxyntic cells. The ghrelin, GHRELIN. Ghrelin, it stimulates the acid secretion. It increases. This is the hormone that is important for our feeling of hunger. This is called hunger hormone, ghrelin. The appetite is related to ghrelin. When somebody's ghrelin is not being secreted properly, we lose the appetite. And even the ghrelin also helps in emptying the stomach. So the protective factors, I was telling, the mucus, the mucin, the mucus secreted by the stomach epithelium covering also protects, and a lot of peptides they secrete and bicarbonates are secreted which will neutralize the acid. It will protect from the ulcerative properties of the hydrochloric acid. So coming down to small intestines again, it will act like a beautiful coordinated by the peristaltic movements which are starting from above downwards. They continue into the intestines as the food is coming. All the impulses reach there, mechanical, hormonal, neuronal. All the impulses together in a uniform way come down and start propelling the food down. So intestines have 2 types of motility. One is a ring-like motility. One is the long circular contraction of the. Suppose this is a big lumen. There is a circular contraction. I'll draw it on the board and show you in whiteboard. This is the circular. There are circular muscles and longitudinal muscles along the walls of the intestines. The circular muscles, it helps in mixing the contents, and the longitudinal waves. So longitudinal waves is something like this. Can you see? So the frequency, again, they are coming every 4 to 5 times every minute they move, and the big waves comes every 1 to 2 hours. This is a circular constriction. This is a longitudinal constriction. This will mix the fluid, and this will propel the food down into the distal parts of the intestines. And all these movements are controlled by the sympathetic and parasympathetic nerve system. So it is a ring-like contractions or propulsive contractions. There are two types. So coming to the small intestines also secrete a lot of the absorption. Water and electrolytes are absorbed from small intestine. That's why by the time the contents, intestinal contents come to the colon, they become little less loose. So these movements are specifically begin after the arrival of the food into the stomach. So even this small intestine gets signals that food has arrived in the stomach, and they start having their own peristaltic movements. And the maintaining of these from the esophagus to anorectal, this is a beautiful mechanical wave, one peristaltic wave that comes from above downwards every 1 to 2 hours. So as it comes down, or the food, the residue comes down to the large intestine, the movements are little different, and they also store the food until you void the stools. Then colon. Colon, again I said colon, ascending colon, transverse colon, descending colon. A lot of absorption takes place in the colon, and the colon also acts like a reservoir, like stomach, and it propels the contents frequently as a peristaltic movements, again controlled by your autonomic nervous system, or you also have a splanchnic nervous system. And intestinal nervous system also, there's a different mechanism. Though it is controlled by the central nervous system, we also have autonomic nervous system and local nervous system also. So three nervous systems together maintain these normal bowel movements. That's why when somebody has diabetes and diabetic autonomic neuropathy, we call it as dysautonomia. Diabetic dysautonomia patients, either they will have a diarrhea, we usually call it a diabetic diarrhea, or sometimes they have constipation. So the neuropathy, the intact nervous system, all three, central nervous system, autonomic nervous system, and the local intestinal nervous system also is very, very important. And the sphincters, the anal sphincter also acts like a mechanical barrier. Even though the angle of the anorectal junction, if you can see here, the angle, natural anatomical angle of the anorectal junction also helps in to act as a reservoir. So only when the signal comes, when the stress reflexes, when the colon is loaded, when the rectum is loaded, it gets stimulation from the central nervous system, and the anal sphincter opens to propel the contents down. So this is a beautiful mechanism, and controlled by the contents, and the abdominal muscle take part in the by raising the intra-abdominal pressure and increasing the abdominal pressure and pushing down the contents out. So that is the total physiology of the sphincter relaxation, sphincter contraction is very beautifully coordinated manner, sympathetic and parasympathetic. Usually parasympathetic helps in sphincter relaxation, and sympathetic helps in the contraction of the anal sphincter.